Hi everyone, Janelle here from Mountain Rebalance, and I just wanted to go over quick the difference between a food allergy, a food intolerance, and a food sensitivity. So this can be really confusing, and there are some key differences. So a food allergy is a true allergy is an immune reaction, and it's an IgE antibody. And it's usually an immediate response, so anaphylaxis or hives. And the most common foods are eggs and peanuts. There's more. You can have an allergy to anything. The second is food sensitivities, and these are also an immune response. So they're different antibodies. It's not an IgE reaction. It's either an IgA reaction, an IgG reaction, or an IgM reaction. So these can be a little bit more confusing because they may take 1 day, 2 days, maybe even 3 days to show up. So it's harder to tell the foods that are causing that problem. And those could be wheat, dairy, soy, eggs, peanuts, shellfish, and so on. Again, anyone can have, or any food can cause that reaction in people, but those are the most common ones. And the symptoms could be any form of inflammation, joint pain, anxiety, depression. Any symptom can be because of a food sensitivity. Food intolerance, I think of that as more of a problem digesting a certain food. So maybe there's an enzyme missing to digest a food. Your bacteria in your intestines may be reacting to certain foods. There may be a lectin problem digesting lectins. So that could be, maybe with salicylates, oxalates, really any FODMAPs, food constituents. So again, those symptoms can be similar to the food sensitivities, where they're more systemic and they take longer to show up. But the mechanism is different because the immune system is not involved. So anyway, I'm going to go more into details on these, but that's the basics, and that's a nice, clear way to think about them so they become less confusing. So food allergies, food intolerance, and food sensitivities. Thanks.